Why should PE, health, prevention and promotion be a part of curriculum in schools? Many parents are interested in the basic academic education of their children such as reading, writing and arithmetic, but are not fully aware of other areas of learning that goes on in the classroom. It is important that a comprehensive health prevention and promotion program blends in the curriculum of schools in order to increase the health knowledge in children, to promote positive attitudes toward his or her own well-being, and to promote healthy behavior. Starting in kindergarten and continuing through high school, it provides an introduction to the human body and to factors that prevent illness and promote or damage health. By going beyond simply increasing knowledge, schools today are asking for more involvement on the part of students and parents in not just developing academic skills but essential life skills. This means that children 7 or 8 years old are not too young to learn about the dangers of alcohol, tobacco and other drugs and sexuality education as a part of their learning in elementary school. This is also because a child's well-being as an adult can be influenced by a lifelong exercise and nutrition habit that she or he adopts now. What are health promoting schools? The Western Pacific region of the World Health Organization, of which Australia is a member, released a major policy document called the New Horizons in Health, which identified three themes: preparation for life, protection of life, and quality of life. The health promoting school was identified as a vital strategic direction for the theme preparation for life. The guidelines of this policy consist of 6 components which are a part of a health promoting school. These include school health policies, the physical environment of the school's social environment, community relationships, personal health skills, and health services. What are the advantages of having PE, health prevention and promotion in schools? Young people today grow up in an environment that increasingly encourages negative risk-taking behavior through negative role models, peer influence, ambiguous role expectation, and media influence among many factors. Young people develop these risk behaviors in varying degrees which impede their educational progress. For young people, education and health are intrinsically connected. Therefore, efforts to improve school performance also needs to include improving the health status of children and adolescents. The most serious and threatening health problem in society today relate primarily to personal decision making and lifestyle changes. The behaviors and lifestyles that lead to these preventable health problems are almost always developed or sustained during the early years of life, especially the school years. Research indicates that healthier students are better learners, so intervention strategies within the schools are effective in reducing a number of risk behaviors as well as reinforcing and maintaining positive health behaviors for most students. What are the disadvantages of having PE, health prevention and promotion in a school? Studies over the past decade have identified approaches to health promotion in schools which are ineffective and should be discouraged. Some of the failed programs are characterized by the following: development of programs in response to a perceived crisis in which scare tactics and preaching were often used; broader school involvement which were irregular and uncoordinated; development of programs based largely on external speakers and resources with little involvement of school staff; provision of little or no investment in teacher training and support resources. What are the justification of why PE, health prevention and promotion should be a part of the curriculum in schools? According to this survey picture that was published in a journal article named Physical Activity for Everyone, what every physical educator should know about promoting lifelong physical activity, Charles B. Corbin emphasizes the need to teach for independence rather than dependence. My belief to having PE, health, prevention and promotion as a part of the curriculum in schools is based on this beautiful illustration that shows getting youth active or getting youth fit or lower order objectives. It is based on the idea if teachers make all the decisions about what to do and when to do, students become dependent and fail to develop lifetime habits. It also shows how to move students to independence by teaching higher order learning, which includes teaching them to self-assess, developed self-management skills such as goal setting, program planning, self-monitoring, and overcoming barriers, and problem solving such as learning how to evaluate a fitness product or a magazine article, which leads to independence and the ability to make lifetime decisions about active living.